Hello, everybody. It's Mark Sage, Executive Director of the AR for Enterprise Alliance, or better known as the Area. And we're here with another Fireside chat. Really excited to welcome Adam Davis, doing some amazing stuff. You can even see the good-looking chap Adam with his equipment on here. So we're going to jump straight in. Adam, maybe start with introduce yourself, if you can. Tell us a little bit about yourself.
Thanks, Mark. It's nice to see you, by the way. My name is Adam Davis, and I am the CEO of Amalgamated Vision. Amalgamated Vision is a optomechanical engineering company, and we design and build the core components for augmented reality headwear. I'm a physician, neuroradiologist. I'm no longer in practice, and I've been involved with visual augmentation for about 20 years with 3D rendering, and in my former occupation, I was an associate professor at New York University Medical Center, and there I ran the imaging labs to do 3D rendering of medical imaging. So I've been in the field for quite a while.
Indeed, thank you. Well, let's just jump into the question. So, how is Amalgamated Vision's products and approach different from other AR devices? We know there has been many on the market, past and present. And why is your startup going to succeed when others, multi-billion-dollar companies, have failed?
Thanks, Mark. Let's jump right into the middle of the conversation.
Absolutely.
So that's really the big question. I think it comes down to user experience. We all know that visual augmentation is beneficial for work, for task, clinical decision making. And we've known that for quite a while. And visual augmentation in all its different modalities, whether you're using a handheld device, obviously a head-worn device, but even if visual augmentation is a manual that's in front of you when someone is guiding you, that's all visual augmentation. And the promise of augmented reality smart glasses was that it would take this visual augmentation and it would put it into a format that made it easier to digest, complex information easier to understand. It would keep it hands-free and mobile, and it would just become part of your life. And that is all there. The potential is there. The promise is there. But I think the problem that has led to the lack of mass adoption has really been the user experience. In order for visual augmentation to be successful, it needs to seamlessly incorporate into your life. It needs to be unobtrusive. It needs to be the kind of thing that you will wear, that doesn't make you feel as if you are burdening yourself with some piece of technology. And that's really the hurdle that we need to get over. And the traditional solutions to now are well known to everybody, in the industry, and they basically fall into the see-through displays or the pass-through displays. And the problem with those is that the technology is great. I admire the technology that people have put out for those products. And for certain use cases, they are spot on. But they are somewhat cumbersome. And they have a significant weight to them. You have to look through a lens. And when you start to look through a waveguide, you start to have all of the difficulties that you would expect. The image quality is often not great. There's a visual interference, a visual dissonance between the objects in the real world, their shape and their borders, and what you're seeing in your glasses. They may not match up geometrically. There's also the planes of focus, the plane of focus of something on your glasses versus something out in the real world. And all of this leads to a cognitive burden. It leads to annoyance, having data clutter in front of your eyes can be very, very annoying. So they're a good solution. They present significant potential, but the human factor is not quite there. And I think what we're bringing to the table is a significantly different user experience. And I think that's really the difference between us and up till now what people have used to solve the problem.
Amazing. Thank you, Adam. And we couldn't agree more. As you well know, we have the Human Factors Committee in the area focusing on some of these challenges. But maybe, we can see with your amazing kind of device there. Tell us a little bit more about the technology and more importantly, the user experience. Well, where are you today?
Okay. Well, first of all, what I'm wearing right now is a 3D print of our of our prototypes, and we are currently building our prototypes, and they will be available in the next 30 to 60 days. So it's a very exciting, time for us. So we initially focused on virtual retinal display, and we used laser beam scanning in order to do a direct retinal projection. Take the picture, put it directly on the retina of the eye, no display screen. And we did that for several reasons, because we realized we were able to take the technology and bring it down to an extraordinarily small form factor. And at first, the obstacles were optical. We had to get over all of the problems that people had brought up that led people to believe that you couldn't use laser beam scanning for a direct retinal projection in a usable format. But we were able to create a large field of view. We were able to create a large exit pupil, that sweet spot that enables you to see the image. It doesn't have to be exactly aligned. We don't need any kind of eye tracking. So we were able to get through these technical problems. And, at first we had it adjacent to the eyes, and we had a data analytics company had invested in us to bring it near the eye, because we were initially thinking stereoscopic imaging, which we were quite good at, in order to have that 3D stereoscopic visualization. But, form follows function. And we realized, wait a second, we should go smaller, and we should put it in a place where you don't see it. And if we go monocular, what we can do is bring up a digital eye and a non-digital eye. And through a mechanism called a binocular rivalry, we can present one image to one eye and keep the other eye unobstructed. And your brain has the ability to oscillate between each eye in an effort to bring the two different images together. And this is a natural, innate phenomenon that people just have. But if you need to keep the digital content simple, and if you do, and you look at the real world with with digital content and non-digital content, your brain will fuse it into a visual mosaic, and you get to see one image. And we've built some demonstrators, and what we've learned is that by manipulating the image, we can create all different types of experiences. If we have a very bright dominant display, it's as if you're looking at your smartphone. It is the dominant display is the digital data. If we bring it down and then we let the real world, the input from the real world come up, then you get this blending as if the digital data is floating in space. And the way we present the data makes it different. If it's a black background, the symbols that we see just stand out. They look like the symbols are just kind of hanging in space. So we learned that there's really a different type of experience that we could create. And it all came down to the ability to make the device small enough to put it in the corner of the eye, and to make it the optics so that you could bring it extraordinarily close to the eye. Our eye relief, the distance to the eye, right now we're designed for about 12 millimeters from the eye. So quite closer than a conventional, pair of glasses, which is more like 30 millimeters from the eye.
Yeah.
But the beauty is that if you have a headset and it's resting against the head and you're buttressed against the nose, it's very stable.
Yeah. 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 You can see. Yeah.
So the beauty is when you look straight ahead, I don't see the display. It's sitting in my nasal blind spot. And if I turn my head a little bit or I divert my gaze, the entire display comes into view and it takes up my central visual field. So that is the user experience, the form factor that we evolved to. And as I said, it was a series of steps. It wasn't immediately obvious to us, but as our technology developed, I guess so did our mental construct about what we could
Yeah.
do with it.
I can imagine. Yeah. And I know, Adam, you've kindly presented to the area members, and everybody's just like really excited about this. I think there's a whole bunch of use cases and problems that can be solved with your setup, and it's congratulations because it's truly amazing. But
Thanks, Mark.
whilst this is all very exciting, what's next for you guys? What are we going to see next? Whilst we're looking forward to the devices, what's on your roadmap?
Well, right now we're building it, and it's important to mention that this is not a final form factor for us. This is what our engineers can build in our facility, at the bench using stereo microscopes. I am sure if I handed this to some global electronics company, they could use robotics and micro engineering and make this about 30% smaller without giving it much thought.
Yeah.
So that's in the future, it'd be nice to redesign this. Right now we are focused on presenting our prototype. We have two customers, the U.S. Air Force and NASA. We are funded through SBIR government grants. We're in a phase 2 position right now. And what we will be delivering to the Air Force is this headset, and their use case is the C-17 maintainers, the men and women who work on the C-17 transport planes. And currently, when they work on a plane, they need to use a laptop to go through their technical orders, their instructions, and it's mandatory for quality assurance. So they need to work, and then they need to turn away and look at a laptop, and then they need to take their tools back up and go back into the engine or whatever they're doing. I don't know much about aircraft maintenance. And what they'd really like is a headset so that they can be working on an engine and be able to divert their eyes and see the checklist or see the schematics, or just be able to take a picture to document what they're doing so that they can improve their workflow. So the other use case is NASA. And for NASA, what they were looking for is a headset to give instructions to take their mission specialists and astronauts through a series of steps in case of medical emergency. So what we're doing is, for our prototype, we took the emergency medical manual on the International Space Station, and we reformatted it down to a smartphone format. Our format, as you see right here, is about the size of a smartphone at about 15 inches. So if you could, anything you see on a smartphone, you can see on this. So we want to present our prototypes to NASA, to the Air Force, and then I think we'd like to move forward and go from the prototype stage into the commercialization phase. It'd be nice to be able to give them something that they could hand to their personnel and say, try this. What do you think of it? And be rugged enough that when they drop it on the ground, as mechanics are wont to do, it still works when they pick it up and put it back on their head.
Yeah. I think just in there, Adam, there's a couple of really great use cases, and I'm sure everybody listening to this can think of a whole bunch of extra ones. I think there's so many problems that can be solved. So I think if it's okay, we'll leave it there. I'd like to kind of follow up with you, and as you move through your journey, thank you very much for being an area member. But it's super exciting. I know the area members are super excited with it, and if anybody wants to reach out, maybe just explain or just say the URL for the website if anybody wants to contact you.
Sure, it's at www.amalgamatedvision.com. And my email is adavis@amalgamatedvision.com. .net. .com. Thank you. And I wanted to give a shout out to you because we really enjoy being a member of the of AREA. We think it's a great organization, and we think the mission is really central to moving the field forward. So we wanted to thank you as well.
Appreciate that, Adam, and look forward to continuing to work with you. Thanks so much.
Thank you.